if there are instruments on it, we could. Well, let's just move that trolley aside and we'll move this trolley over, and we could put that on afterwards and see what treasures there are inside.
This is a cystoscope. A gynaecologist often performs cystoscopies, usually diagnostic cystoscopies. Particularly, urogynecologists assess the bladder, and also oncologists often do a cystoscopy as part of staging for cervical cancers to ensure there is no involvement of the bladder mucosa. Sometimes you have to do a cystoscopy after doing a suspension procedure, for example, like a transvaginal tape procedure, to ensure the tape has not penetrated the bladder wall. So there are various circumstances where a gynecologist may be called upon to do diagnostic cystoscopy. Sometimes even the need to do a little bladder wall biopsy. The cystoscope obviously is like any endoscope, has a sheath and a telescope. This is a bridge, as you can see, which allows a safe securing of the telescope to it, watertight. So this is, for example, this is a 30-degree telescope with an angled tip to it. And if you see the bridge allows you to, in addition to connecting it to the irrigating sheath, it also allows you to pass instruments through a channel. In this case, this would be to allow the passage of a biopsy forceps. Now this is the sheath of the cystoscope.
Sorry?
To stent it.
Yeah, the importance to do a biopsy, the scope would actually go onto a pair of biopsy forceps and then go down the channel.
Yeah, so this is particularly used for ureteric stenting if you're doing complex surgery, for example, endometriosis. Are you recording this?
Sorry?
Are you recording this?
Yes.
So for example, this operating channel, you can pass a stent through or a guide wire through to cannulate the ureteric orifices if you're doing complex surgery to make the ureters easily visualized at surgery. The sheath itself is put with an obturator to avoid damage to the urethral mucosa, and there is an inflow and an outflow channel, as you can see, and this also is graded with measurements on it. Not particularly useful for the female urethra, but cystoscopes are unisex, which are used for both men and women. So, but in women, perhaps not as useful because urethra, as you know, is quite short, about 4 centimeters or so. The tip avoids trauma to the urethral mucosa, and once this is inserted with the irrigating fluid, which is usually water or saline, you remove the obturator and insert the telescope. Usually there are marks on the telescope which allows you to correspond so that you don't have to struggle when you put it in. As you can see, in this case you can see 0 marks. Sometimes there are red dots. So you correspond to that and then you turn the lock and then secure. You connect a light cable to this and a camera to this, obviously, unless you're directly visualizing. These days you do video cystoscopy rather than directly visualize through the telescope, and this is attached to a light source.
Lovely. I'm just thinking, how are they going to distinguish people who are not familiar? How will they distinguish it from the hysteroscope?
I think the main difference with the telescope essentially would be very similar for a hysteroscope and a cystoscope, and they are, in fact, the hysteroscopes are forward-facing as well. It comes in different angles, ranging from, there are 0-degree hysteroscopes, but again, most commonly you use an angle telescope even at hysteroscope, at hysteroscopy. But I think the difference is the irrigating channel.
And the need for the big obturator.
Yes, and the obturator. So the end of the irrigating channel is quite curved to avoid